Nights program. Dr. Sasmita is a professor and director pediatrics at the High Tech Medical College and Hospital at Bhubaneswar. Her brilliant academic credentials include fellowship in pediatric neurology, fellow in epilepsy and paroxysmal disorders, as well as fellow in special education from the UK. Madam Sasmita has earned many distinguished titles as founder and president AOPN Odisha, National Editorial Board member of AOPN, and national tutor in autism, CNS infections, genetic and rare diseases. She has many other national and international accolades as well. She is the recipient of the Purbanchal Pioneer Award, Global Icon Award, APJ Abdul Kalam Inspiration Award, and the Golden Aim Award. Without much ado, I now call upon Dr. Sasmita Madam to take the program forward by introducing the moderator, Dr. Vinit Vankade.
Hello everyone, I am audible.
Yes, madam.
Good evening everyone. Thank you for those kind words. I am really thankful to Intas for having me here today. Today's topic is cannabidiol in the newer vistas in the management of refractory epilepsy. For that, we have the eminent speaker with us today, Dr. Vaikuntha Raju, who is one of the most experienced and learned pediatric neurologists of India. And to moderate the session, we have Dr. Vinit Wankhede. He's the director, Kid Neuro Clinic, Lokmat Square, Nagpur. And he's the consultant pediatric neurologist and epileptologist in New Health City Children Hospital. And he's the editor of Indian Journal of Pediatric Neurology and the National Joint Secretary of Academy of Pediatric Neurology and National Scientific Convener of Academy of Pediatric Neurology. Over to you, Dr. Vinit, to moderate the session.
Thank you, ma'am. Good evening, all. First of all, thank you for that kind introduction, and thank you, Intos, for this opportunity. I take a lot of privilege to introduce Dr. Vaikuntha Raju as today's speaker. He is a very distinguished academician, as already told by madam. He currently is a professor of pediatric neurology at Indira Gandhi Medical Institute of Childhood at Bangalore. He's a DM from AIMS in Delhi in pediatric neurology. Recently, and I take this opportunity to congratulate and honor him because recently been awarded as the outstanding contribution in the field of child neurology by Association of Child Neurologists at recently held conference in Vellore. So he has outstanding contribution in the field, and he authored the textbook and 25 chapters in different textbooks. Also, he has a lot of national and international publications, more than 100 on his credit. So I request Dr. Vaikuntha Raju to take on this topic, that is cannabinoids. So there is a growing interest in the field of newer antiepileptics because we see in our pediatric epilepsy, almost 1/3 of the patients remain refractory no matter what drug you choose. So always there is a concern that we have to avoid the surgeries and non-medicinal use of other techniques to be avoided. So always we try to rely on most of the anti-seizure medications. So recently a growing interest has been seen and we have seen a lot of US papers coming up in last decade about the use of cannabinoids in few indications. Now the spectrum, and this is which is going to increase over a period of time. So on to get an update on this topic, we have Vaikuntha Raju. I think without wasting much time, over to Dr. Vaikuntha Raju, sir.
Thank you. So at the outset, I thanks Intas for giving the opportunity to speak on this upcoming subject. Shall I share my screen?
Yes, sir.
Is it visible?
Yes, sir.
My slides?
Yes,
Okay.
sir. Yes, sir.
So
please go ahead.
So good evening to all. So today topic is on cannabidiols. So that is newer recently introduced drug in India for the treatment of refractory epilepsy, especially in children. So this is the outline of my presentation. Initially, I'll be talking in short about recent cannabidiol, pharmacodynamic and pharmacokinetics and dosage and indication, followed by three more common indication in general, like LGS, Dravet syndrome, tuberous sclerosis, followed by some other indication, and also about our recent experience over the last 3 months. Coming to LGS, this is a common syndrome we'll see in pediatric age group, one of the most difficult to treat refractory epilepsy syndrome in children. So, as you know, it is refractory. Most of the children difficult to treat medically, and also most of them may not be amenable but to surgical management and also dietary management. So, this is a current treatment options currently available for LGS patients all over the world. So most of the times you will treat initially with valproate and lamotrigine with some amount of benzodiazepine, and most of the other drugs are add-on drugs. The response rate usually will be less. So there is a lot of need for the newer drugs. So where cannabidiol is one of the drug that is most useful currently, currently introduced drug. So this is unmet needs in LGS management. Even though there are 6 drugs approved by FDA for LGS management, most of these children will get a poor response with currently available drugs. Some of the drugs may not be available in India also. And we see that lot of side effects with these medication also. So there is a need for newer anti-seizure medication, especially in LGS. So where the CBD has a major role. So currently, where it stands, CBD in LGS is usually the NICE guidelines in 2022 indicates that it can be used as early as the third add-on drugs in management of LGS patients. This is the guidelines published in 2022. And in the Germany guidelines, they will tell even can be added as early as after failure of two medications. So usually we will see LGS after 2 years. So usually it is approved after 2 years, and I say the Indian DCJ approved after 1 year also. So it can be used as early as second or third drugs. Cost is not a factor. So coming to Dravet syndrome, this is a brief introduction about Dravet syndrome. As you know, that is one of the commonest epilepsy syndrome we'll see in children again. And there are various medicines available for this syndrome also, but you see that most of the time these drugs may not be helpful with the treatment of these children. So some of the drugs that are commonly approved are not available in India is teripental and penfluramine. They are recently, teripental, even though it is a very old drug, but not available in India till now. And penfluramine recently approved by FDA, but currently not available. So these are other medicines, even though approved and available, but most of the children are refractory to currently available drugs. So where the CBD has a major role. So current management has already discussed the old drug like valproate and also the benzodiazepines and stiripentol as a role, but we don't have currently this drug currently available. And also you should know that some of the drugs should not be used in Dravet syndrome, like sodium channel blockers that are commonly used in focal seizures like carbamazepine and oxcarbazepine, lamotrigine. So you should be careful. So current treatment options, I already told that old drugs like valproate and clobazam, followed by other add-on drugs, but the response rate is very less. So where there is a need for new medicine like the CBD oil. So even though FDA approved, as already discussed, stiripentol and penfluramine, they are not currently available in India and not approved by Indian government, DCGA. And regarding this is again the recommendation for Dravet syndrome in the management by NICE guidelines 2022. So again, it says that it can be used as early as in the second order drugs after failure of first medicine like sodium valproate or stiripentol clobazam. And similarly, the Germany guidelines also recommends that it can be used as early as second line of drugs. Coming to the next common indication of CBD is tuberous sclerosis. Tuberous sclerosis, as you know, that it is one of the commonest neurologically. They present with refractory epilepsy initially with epileptic spasm. Even though they will control with vigabatrin, that's the most commonly used drug, but later they will come back with again seizures, and you cannot use vigabatrin for long term. And there are various other options available like precision medicine, but currently there are a lot of limitation for these drugs like everolimus and all those things because of side effects and cost factor also, where the CBD has also has a major role. So coming to the CBD itself, so it is known that it is there from many decades, many centuries, and initially it is discovered in Eastern Asia, and it has a long history of domestications used for many purposes like recreational and medical purposes also for the many years. And it has a different species. Most commonly is cannabis sativa, and there are various nomenclature that used to be used earlier, like marijuana, ganja, all those things, but they are not pure CBD forms. There are contain many chemical compounds. There are more than 500 chemical compounds in the CBD, but the medically that is useful for epilepsy management is CBD component. That is more important. That is non-psychoactive compound. There is less addictive effect and also not a major psychiatric effect. So earlier, before introducing this CBD by DCGA, there was some formulations available, but we didn't have the exact content of CBD versus THC. But some people used to respond. But so I will give you some comment. What is the response between older version and new version after at the end of my talk? So currently available CBD is a more of non-psychoactive component. The more than 99% belongs CBD component rather than THC component. So as I told, it is introduced more than a century back, and it is used to be used for many disorders. Now also there are many trials with various other disorders, not only the epilepsy, like anxiety, psychiatric disorder, chronic pain disorder, and cancers also. And it is introduced recently in synthetic form rather than the natural forms. And synthetic forms are equally similar pharmacokinetic properties compared to plant-based one. So with some advantage, the CBD component is more. This is a history of CBD. So initially, the chemical structure of CBD is identified in 1940, and there are various preclinical studies conducted in 1990s and 2000. And in 2013 to 18, there are main studies that are contributing for FDA approval for this drug. And finally, US FDA approved in 2018 for usage of cannabidiol in the case of children with LGS, Dravet syndrome, tuberous sclerosis. And also European Medical Association also approved in 2019, and Indian government DCJ approved in 2023 December recently. So there are various components. Earlier also used to use CBD, but the main differences is earlier version we don't know the exact the different what is the compound concentration of THC versus CBD. So there's various other brands that are available. So where the concentration of THC is more, some of them may be more than CBD, but currently available is more than 99% CBD component, but other THC components is very less. So coming to pharmacokinetics, it has a low bioavailability, but it has extensive post-pass metabolism in the liver, and it has a lot of variation between individual to individual, and usually the maximum concentration reached usually after 3 hours after the starting the dose, and it may takes up to 2 to 4 days to maintain the steady level, and it has high lipid solubility and also high protein binding capacity. You should be careful when you're using those drugs which are commonly used with high protein binding capacity, like old drugs like phenytoin and valproate also, because drug interaction can be more. So lipid solubility and high protein binding, these are some of the pharmacokinetic factors you should be careful. And half-life is around 3 to 4 days, and may takes the main concentration reach up to 7 days. Also, may sometimes you may need to take at least need to see 7 days to get the response in some of the children. So basically, it is a strong enzyme inhibiting properties, and you should be careful whenever there is a liver impairment, especially in liver impairment. There may be a drug toxicity, and you should be careful. And it is basically metabolized in the liver and excreted in the gut. There is less clearance in the renal system, and it requires dose adjustment in liver injury. There is this is a mechanism of action of CBD. There are three main mechanisms for action of CBD. So they are little different from currently what drugs currently you are using, like many of the drugs. The mechanism of action is entirely different from the like older drugs and also some of the newer drugs. So that is one of the advantages, so that you can use this drug as additive, sometimes synergistic effect also with old drugs. So there is no much interaction as far as the mechanism of action is concerned, but other than like interaction in the form of the protein bonding and liver injury, you should be careful. So The three main mechanism of action. Basically, it talks first mechanism is acts as GPR 55 receptors, where basically the GPR lysophosphatidylate inositol is a natural agonist to the GPR 55 receptor. When LPA binds to GPR 55 receptor, it causes calcium influx and causes triggers. But CBD blocks this receptor so that it inhibits the seizure activity. This is the first mechanism of action. Second mechanism is it desensitizes the TRP1 receptor. Basically, these are more in case of epilepsy, especially drug refractory epilepsy. These receptors are excited, upregulated. So CBD basically downregulates this receptor, causing anti-seizure mechanism. The third mechanism of action is inhibition of adenosine transport. So where usually adenosine is an proactive to seizures. So it basically it inhibits, so it is an anti-seizure properties. So this mechanism of action is different compared to currently available drugs, where it can be combined with the older drugs also. So these are some of the drug interactions. Basically, the drug interaction happens when you're using those drugs with the protein binding and those that are metabolized in the liver. You should be careful. Otherwise, not much side effects. I'll be telling in detail some of the drug like stiripent and valproate when you're using, and clobazam also. So this is a DCJ approval in December 2023. So this is approval starting dose initially is 2.5 milligram. The dosage is different for tuberous sclerosis compared to LGS and DS. Dravet syndrome, LGS, DS, Dravet syndrome is a lesser dose compared to tuberous sclerosis. Tuberous sclerosis, they advise not only Indian government, other countries also the higher dosage is recommended. So initial starting dose is 2.5 mg per kg, and it should be taken twice daily, and it can be increased up to 20 mg, and in case of tuberous sclerosis up to 25 mg. It should be increased weekly basis. So in case of hepatic involvement, as already discussed, the dosage should be reduced based on moderate and severe impairment. The dose should be half or one quarter should be used, and you should be careful both in LGS Dravet syndrome phenotype and also TSC group. So I'm coming to in detail of the various studies conducted in subgroups of these syndromes. Initially coming to LGS, this is where the initial studies was done. So this is a study initially published, and one of the reason why FDA is recommended for this medicine. So this is a study published in New England Journal of Medicine. The use of CBD in drop seizures in LGS syndrome, where the three arms are RCT of three arm. One is placebo, other is one drug, one concentration 10 mg, other concentration is 20 mg is used. So you can see there is a significant reduction in the seizure of placebo versus the 10 versus 20 mg per kg. So the 20 mg little better compared to 10 mg. Placebo is definitely less, and there is a significant improvement in the seizure frequency. Not only the drop seizure, you can see the total other seizures also. There is a reduction in the seizure frequency. This is total, and this is non-drop seizure. So all the seizure types are decreased in this study, and so reduction of more than 50% and 75% also noted in this group of patients. So adverse effects are usually the minimal. Most common adverse effect you are also notice sedation and decreased appetite and diarrhea. And other major concern is the liver, increase the liver transaminases. Usually they are less, not more than 3 or 4 times, and most of the time they are reversible. And other more important study that is published in Lancet regarding the other types of seizure with the LGS phenotype. So again, this is an RCT combining placebo versus of CBD of 20 mg per kg. So again, this you can see that there is significant decrease in the seizure frequency in the treatment initiation period and also maintenance period over 14 weeks. And you can see similarly the reduction in drop seizure also noted, non-drop seizure also. And you can see that there is an improvement in quality of life also, these children. So most of them are significantly improved. So the worsening is less. You can see the right side wise, there is a significant improvement, not only the seizure frequency, overall the functional capacity and overall outcome of the quality of life also improved with these children. And this is again graph showing that not only the seizure frequency, other things also, there is a significant improvement not only initially and during maintenance period also. Coming to Dravet syndromes, this is a study again published in NEGM in children with the Dravet syndrome with drug-resistant epilepsy. Again, this is a RCT comparing placebo versus 20 mg per kg. So you can see that there is a significant difference of 20 mg versus placebo, and p-value is significant. And you can see some of them are seizure-free also. So up to 5% of seizure free with this CBD in CBD group versus placebo groups. So the side effects are minimal as sedation and diarrhea and minimal increase in transaminases. The same thing is represented. So significant improvement in CBD group versus placebo, and they are statistically significant. Coming to this tuberous sclerosis, this is published in JAMA Neurology, again RCT. So again, this study used placebo and two concentration, 20 mg versus 50 mg dosages. And you can see the result. They compared not only the CBD with placebo and different constants. They also compared those with the clobazam and the clobazam. So in this, you can see placebo group compared to 25 and 50 mg. That 25 and 50 mg, there is not much change, but there is significant difference between placebo and the drug group. So there is significant decrease of seizure, total seizure, and also more than 50% reduction. Again, this study shows that the reduction is better with clobazam group compared to without clobazam. So in the same study only. Same thing is represented, and side effects are less. Coming to the other studies other than these RCT that that are done in real world experience, this is study, especially the multicentric retrospective study in children, not only adults. This is only in the children base. It is a multicentric retrospective study. You can see that again, this retrospective study basically included three main groups and also other refractory seizures. You can see there is significant improvement in all subgroups of and also other causes for refractory epilepsy. The 50% reduction is significantly better. And change is seizure frequency again in the different proportion. It is represent the same thing only. And this is Kaplan-Meier's plot. It is showing that most of them are able to maintain the drug without discontinuation. That indicates the tolerability is good for this medication. Coming to other studies and meta-analysis, this is one of the meta-analysis of CBD in children, in patients with LGS, Dravet, and tuberous sclerosis. So this all basically they notice both short and long term tolerability of CBD. They are all selected only RCTs, and they noted not only the seizure, they assessed the functional improvement also, and also adverse events. So you can know that most of these studies, this forest plot shows that it favors the seizure epic greater reduction in 50% seizure in favors the CBD group compared to placebo group, and adverse event not much difference. So maybe minimal side effects is more in CBD, but they are all temporary and the short duration side effects. And again, the functional improvement is in favor of CBD group compared to the placebo group. And total adverse events again not much significant, but little more common in CBD group. And severe adverse effect also less common. Only few of them are transaminase elevation, and more than 3 times transaminase due to only few cases. And this is again the reduction in the seizure frequency. You can note there is again it favors CBD group compared to placebo groups. So there is the improvement in the seizure frequency and also less side effects, and also overall functional scale also improved with this based on this meta-analysis also. And meta-analysis comparing the CBD with clobazam in four randomized control studies. So where their studies almost 400 patient of LGS, around 300 patients of Dravet syndrome with or without clobazam. So most of the most of the studies indicates that the efficacy is better on children, patient with clobazam versus without clobazam. So, and other meta-analysis is showing long-term efficacy adverse effect of CBD in drug-resistant epilepsy. This is a group analyzed various other factors that will going to influence based on age. Overall, this is overall response. There is a significant improvement, and this is a based on age group. You can notice that the all age group they are able to maintain. There is a significant decrease in seizure frequency, and this is based on dose subgroups. So they can they have a significant response based on subgroup also, and this is a short showing other anti-seizure medication. There is not much difference in the combination with other drugs, not much significant interaction. And this is a chart showing different epilepsy syndrome. We can note that most of the epilepsy syndrome respond not only what three major indication, and also at 2 weeks, 12 weeks across the studies, there is a significant improvement. This is a same study showing seizure-free rates are noted in similarly in all age groups and all different subtypes and also various epilepsy syndrome and adverse events also overall not much difference between age group and also different medication and also different epilepsy syndrome and overall. And serious adverse events also same, not comparable in different. This is another systemic review of Cannabidiol. This is a old version that was available before the CBD, the pure synthetic forms. So where their studies, the 8 studies were included, all of which are RCTs. So many of them are Dravet syndrome. And this RCT shows that there is not much difference between placebo and this CBD. This is a study. This is before introduction of pure CBD form. There is not much difference between. So almost equal, except this is a one study that you only two form of CBD. There is significant improvement as noted. And this is one more meta-analysis of CBD. This is a pure form of CBD compared to the previous one I discussed. So this is again comparing the RCTs of three main epilepsy syndromes, so where it is a pure form is used. So you can see in this it favors the CBD compared to the previous meta-analysis of the combination of THC and CBD component also used here. So again, it meta-analysis shows that it is effective in reducing seizure and also it is effective in all three subtypes of seizures and also more efficacious those who are receiving clobazam and without clobazam and the side effects are minimal. So what you should monitor when these people are on these CBD and what is a long-term outcome? These are some of the studies that looked into a long-term efficacy of CBD. And this is showed more than 4 years. They followed up old studies, RCTs. So none of them are developed severe side effects. Most of them are transient side effects, and they're able to maintain the efficacy over a period of 4 years. And this is adverse event profile. The minimal adverse events and serious adverse they are very minimal, only few percentage. There most of them are manageable. And this study shows that the type of seizures there is improvement in not only the drop seizure and total seizures also decrease, and responder rates of different proportion also there is noted that not only drop seizure, total seizures also decrease. So its role in other epilepsy syndromes, as I already discussed, that it has a different mechanism of action. So it can be used in drug-resistant epilepsy other than TSC, tuberous sclerosis, and LGS also. This is usually open label trial again, where it is used in many other subtypes of epilepsies. They analyze safety analysis upon 62 patients. You can see that there is a significant improvement in the seizure frequency overall over a period of 3 months. And again, this is one more largest study where CBD is used. You can see that up to 70% of them, there is a significant reduction in seizure. Not only this, some of them may be seizure free up to 5 to 10%. Some of them, there is significant response, not only the seizure free, but 74, two-thirds of patient has significant reduction in the seizure frequency. The overall, they are all well tolerated. The side effects are minimal. So as already discussed. And regarding the drug interact, there are few studies comparing the CBD with other drugs like stiripentol and valproate. So where that is commonly used, drug valproate is commonly used all subtype like TSC and Dravet syndrome LGS also. There is not much interaction between CBD and valproate, except you should be careful in reducing the liver damage because both can be nephrotoxic. Regarding CBD, cisterepental, that is commonly used drug, but even though it is not available in Indian context, there may be some increase, but not clinically significant interaction. This study recently published in use of CBD in fires. These two patients they are published. So both patient become seizure free after starting 1 month of CBD oil, and they are seizure free almost 1 year. So only two case reports. So there are various other studies, usage of CBD in various other neurological, non-neurological conditions also, like leptospirosis, electrical status, epilepticus, acute pain, and Parkinson's, tuberculosis, various other studies. And earlier I was told that it used to be used, and nowadays also many other indications are also there. So coming to the prescribing pharmacology, so it is available usually in 60 ml solution, and usually 1 ml contains 100 mg. So most of the packages, there are two syringes are available. One is 1 ml, other is a 5 ml. So because most of these children may require zero point 0.1, zero point 0.2, zero point 0.3 also, it is important to explain to them that syringe and what exactly they should take. So the standard is 1 ml contains 100 mg of CBD component. And this is a dosage schedule. I already told it should be started very slowly from 2.5 mg, and it should be increased to 20 mg based on responsive requirements after observing side effects weekly once. And dosage is 25 mg maximum in case of tuberous sclerosis and 20 mg in case of LGS and Dravet syndrome. So method of administration is usually it should be administered orally. If there is no orally not taken, you can use as a NG tube, and gastrostomy tubes also it can be used. It is compatible, and it should be taken with or without food, but it should be administered the same time only. Each in the given child, it should be given whether if you are advising before food, after food, or with food, it should be maintained same pattern in daily also. It should not be changed. And if there is a missed dosage, should not be compensated. If there is more than 7 days miss, it should be re-titration should be done. And discontinuation, if you want to discontinue, it should be discontinued 10% body or 10% per day or per 10 days. This is instruction per use, as it is there most of the insert package. No need to go into detail. Regarding the contraindication, main contraindication allergic to CBD and liver problem, especially the SGOTPT is more than 3 times upper limit, and bilirubin more than 2 times upper limit. And warnings, especially the liver injury, and there is some risk of suicidal tendency, and you should be careful when withdrawing other anti-seizure medication along with this. These are common adverse events as already discussed: liver injury, diarrhea, drowsiness, decreased appetite, fever, and feel more sleepiness and tiredness. So this already I told. So to summary, there are more than 10 studies to recommend that CBD can be used. Whatever we discussed, mainly not only the three syndrome, other drug-resistant epilepsy, and there are many countries recommended. USA, European countries, Australia, Canada, including India, also recommended. So this is some of the guidelines I already discussed. So the NICE guideline advising to start as early as 2 or 3 failure of anti-seizure medication, not only in Dravet syndrome, LGS also current protocol. So key highlights, it is available in 1 mg, 100 mg in 1 ml, and it is main indication LGS, Dravet syndrome, and tuberous sclerosis in children more than 1 year of age. And there is a significant seizure frequency, not only drop attacks, other than drop episode, there is an improvement in convulsive seizures also, and the side effects are minimal. So silent features are, it is currently available CBD approved is more than 99% CBD component. There is no THC component much. And there are three novel mechanism option that is very important to combine with other anti-seizure medication. Most of them are drug-resistant epilepsy. You should be using many of the other anti-seizure medication. And it can be added with sodium channel blockers when required. So no much interaction. Is minimal drug interaction other than what I told discuss, and it is effective in what three syndrome and other causes of drug-resistant epilepsy also. And it has shown that many studies already done RCT. It is proved effective, and it is approved by many countries also. So this is our experience over a period of 3 months. We have used almost 60 patients for CBD. There are two children seizure-free, one child with a Down syndrome with initially epileptic spasm syndrome, later LGS phenotype. This child already tried many all the available anti-seizure medication, including ketogenic diet and steroid, vigabatrin. And that child already used to be used the older version of CBD where there is exact composition was not those. So this child after starting newer version there is a seizure free almost child since 1 month. One more child with developmental epileptic encephalopathy due to SYNGAP mutation. Again, this child already tried with all available drugs currently. So that child also becomes seizure free after starting within a few weeks, 1 week only. So these two children are seizure free within 1 week only. The other, some of them, there is a more than 75% reduction in 4 children, two cases of LGS because of neonatal hypoglycemic brain injury. One child is a focal cortical dysplasia, even though surgery is indicated, parents are not willing. One cause most probably probable immune mediated, they are not responded for immunotherapy. There is more than 50% reduction noted in 5 children, and side effects are mainly we notice sedation is the main side effect. Some of them discontinue because of not effectiveness also. Thank you.
Thank you, sir. Thank you for that enlightening talk. So I think Dr. Vaikuntharaju has well covered the topic in detail about when to use, what are the indications this means for, what is the dose regime, and what precautions to be taken, and what are the side effects. So he has touched all the topics and consent to cannabinoids. So what he has experienced is that apart from these indications is used in the another refractory. So my question to Dr. Raju sir is, do you use in every single drug refractory cases, or you will have a few subset of patients, and what is that subset of patients which you are going to use?
Well, you'll use most of the times currently because of cost factor. All most of the times already should have been tried with many of the drugs. So basically, you lose those children with Dravet syndrome because there is less option, and LGS patient already should have been tried. Basically,
Yeah.
those who are getting very frequent seizures
Yeah.
and most of the
Like,
developmental epileptic
apart
encephalopathies
from
also
the
you are
comment,
trying.
apart from the three main indications, will you use in any other drug
Yeah, yeah.
resistant epilepsy?
Yeah, as already told, one child has a SYNGAP mutation. Developmental
Focal
epileptic
cortex.
encephalopathy is the other group of disorders very commonly used.
Okay. Okay. So
Other than
uh, I think we can involve all the panelists here. So may I invite all the panelists? First, I would like to introduce our panelist, Dr. KP Sharma. He is ex-director and superintendent of BIMHANS Institute. He is a consultant psychiatrist and Sanjeevani Laser Clinic, Patna, Bihar. And we have Dr. Lokesh Saini, who is assistant professor of Department of Pediatrics. I think he is heading the pediatric neurology department. He is DM pediatric neurology from Jodhpur. Dr. Varsha Vaidya, she is a consultant pediatric neurologist from city of Aurangabad. Dr. Shikha Jain from my own city, and she is assistant professor at the Department of Pediatrics, AIMS Nagpur. Dr. Pratik Panda is a pediatric neurologist from AIMS Dehradun, and Dr. Ajay Goenka is a senior consultant pediatric neurology, Eternal Hospital, Jaipur, Rajasthan. So I think my first question to Dr. Lokesh, what's your take on it, and what is your practice, and how many number of patients you have used, and what is your experience? Lokesh is there? Hello, Lokesh is there?
Maybe sir, he's traveling. So
I think
he's
Dr.
traveling.
KP Sharma sir is there. Sharma
Yeah.
sir, can you just enlighten us on the different aspect, because you are in the background of secretary, so I think we can enlighten on the topic. What are the indications you're using, and what is your experience?
Since last few months, I have started using it,
Okay.
especially in cases of resistant epilepsy, those children who are not responding to other line of treatment, especially the cheaper drugs that are available here. And in those patients, except in one patient, I stopped giving the drug because the child developed rashes here and there. All the patients responded well to starting of cannabidiol. and in 1 month follow-up, they were doing well. Regarding availability of drug, it is available now in Patna only, not in peripheral part, and the cost is too much for Bihari patients to purchase. So we must keep into consideration reducing the cost of the treatment to the patient, because giving 15,000 rupees at a time may be a problem for these patients. And most of the patients, they come from middle class or lower class family. That is my experience. It is a good drug, but cost would be reduced.
Yes, I totally agree that the cost is really challenge in our setting, especially in the way patients are coming from rural and low income group. Now the issue is that we are using it but it is sometimes very useful in that subset of patients where specifically the tuberous sclerosis one and those refractory cases where we get seemingly good results in the Dravet syndrome as well. So I think we will move to the next question, that is to Dr. Shikha. So what is all monitoring you do during the when you start, and what are the side effects of this drug? Shika, can you just have a brief side
Yeah,
effect profile?
yeah, sir.
Shika is there.
Yes, sir. Yes, sir.
Please unmute yourself.
Can you hear me, sir? Yeah.
Yes, yes, you are audible.
No, we can't hear you. Unmute yourself.
Okay.
Can anyone from the host unmute her?
I think I'm audible.
Yes, she's audible. Yes, madam. You're audible.
Yeah, sir. Yeah, we can hear you, ma'am.
Yeah.
Yeah.
So actually, as Raju sir have already spoken in detail about the side effects, I think the most important point in monitoring would be our liver profile.
Yeah.
Should be doing it at the baseline and then at 1 month, 3 months, and then 6 months, and then we can do it on 6 monthly basis. So that is one point that we can add on to what elaborate talk that sir had given.
Do you have what is your experience? Means like have you
Yes, sir.
used in your patient?
I have treated two patients. One is of Dravet and one is of tuberous sclerosis. The Dravet
Okay.
one is seizure free actually. Tuberous
Okay.
sclerosis, there is some recently started. There is some reduction in seizure frequency, but not yeah. Side
Okay.
effects are not very significant in both the patients.
Okay. Over to Dr. Varsha Vaidya, madam. What is your experience, madam, and what will you have you used in other indications, other apart from this, and even in this indication? Please share your experience.
Yeah, thank you, Dr. Vinny. That was an excellent talk by Dr. Vaikunta Raju, which has really explained every minor detail of cannabidiol. I have around 6 patients of on cannabinol, two of Dravet syndrome, two of tuberous sclerosis, and two we have started from one for neonatal hypoglycemic brain injury, and the child had seizures which were intractable, and almost 4, 5, 6 drugs we have been using. He was constantly on steroids, and another patient of developmental and epileptic encephalopathy, which was genetically proven. All these cases have responded. Although the child with DE and NHBA have not responded well as for Dravet and tuberous sclerosis, there are very minor side effect profile which is reported as nausea and diarrhea. There was no paradoxical increase in the seizures. So it was, in all, it was a great experience beside the cost factor, which really patients are not able to afford. Otherwise, it was a long-awaited drug for us who have refractory seizures day in, day out. Although there are so many patients who will be benefited by this drug, but probably the cost is a prohibiting factor, which may come down in a near future, which I guess.
Correct.
I do have a question for Dr. Vaikunt and maybe other panelists. All the studies which have started in Western part of the country, Western countries, from 2013 to 18, and they have a long clinical profile, and it has just now approved in India. And all these effects of cannabidiol are because of the different expressions of the receptors. They have a different action other than other anticonvulsants. So do we have expect some different response in Indian cases because we have a different genetic framework? and because it was used, the marijuana products were used in ancient Asia since long. Is it that we may get a different response for cannabinoids?
Yeah, Vaikunta sir, can you address that question?
You are muted, sir.
Yeah. So the regarding the etiology in children in the Indian setup, most of the times you will see more of structural pathology like neonatal hypoglycemic brain injury is the most common currently, and HIE also. But on the other way, the Western country, genetic epilepsy is more common. Maybe Dravet syndrome and tuberous sclerosis most common. The response rate may be less, but based on mechanism of action of CBD, I don't think any genetic factors influence the mechanism of action of Western versus Indian patient. But the response may be different because the etiology is different in our set compared to Western setup.
So we have studies on Dravet syndrome, tuberous sclerosis, and LGS. So is it that in India we may use 90% of the times the HI and NHBI patients? It may happen.
Yeah.
And
Yeah.
do you recommend that?
Yeah, it should be used because we don't have any other option. That is a recommended treatment for LGS patient also because no most of these NHBA patient hypoxia will go for up to 2 years. Definitely, the Lennox gases, where most of the times you should have been tried most of the currently available drugs, and most of them may not be candidate for surgery also. And diet is also a lot of limitation, may not be able to
Yes, sir.
sustain for
Any
long.
medical legal implications?
For
Sir, any
CBD,
medical legal implication of CBD?
for
Because if this been indicated only in 3 indication, if you're using in other indications because it's potential drug of abuse, we can say. So can this be? You can address this question.
Yeah, as of see, there is the studies showing that it is useful. What I will documented also, but the recommendation may comes later. But after explain to the parents
Okay.
that there is no other option, this is already studies are there, so you can explain to them and you can advise if they're okay. Most probably,
Yeah.
patient may be able to take.
Because the refractory subset of patients in children, the one what my madam has pointed is the refractory NHBI, and another is the again the symptomatic or the some West syndrome linked with the HIE or even the refractory West syndrome category. These are the refractory epilepsies do persist to have seizures. So I think as sir has said, we can start using it. Over to Dr. Pandya sir. Can you just enlighten us on your experience? Dr. Pratik Panda, is he here?
No, sir.
Is not here. Dr. Ajay Goenka?
No, sir, he is not
He-
available.
He's not available.
Okay. Both of them are not available. Okay. So, with the chair's permission, can Madam add to the topic? Sasmita Madam, what is your experience? Have you used in some subset of patients? Sasmita Madam is there?
Yeah. I am
Yeah.
very much there.
Yes,
Um,
yes, ma'am.
Actually, there was we had a previous session with the
Yeah.
neuropsychiatric, neuropsychiatric people. There I was explaining, I have used around 10 to 15% with this CBD cannabidiol.
Okay.
Most of them are LGS, and I have used in 2 cases of Dravet syndrome. And LGS, most of them are either due to HIE sequelae or due to neonatal hypoglycemia. And
Okay.
one was a case of a sequelae to posterior reversible encephalopathy syndrome. And in that particular case, I had a dramatic response in the second week of this cannabidiol. And the child was on 5 or 6 anti-seizure medication, and very frequently he was on this steroid. Even when he came to me, I also restarted the steroid for him, because at that time cannabidiol was not available in India. But luckily, after restarting the steroid on the second week, I get this cannabidiol, and we start cannabidiol for this patient. I started the cannabidiol, and at the second week, for this particular case, I had a dramatic response, and the baby is completely seizure free. right now, and he has completed 1.5 months of this cannabidiol, and he has also started to attend the play school. And about tuberous sclerosis, I have not used up till now. But in Dravet syndrome, both of the Dravet syndrome has dramatic response. And I have not used it in any genetic, I mean, developmental epileptic encephalopathy. Most of the LGS cases are either due to NHBI, neonatal hypoglycemia, or it may be due to the HIE. And I think most of them has the seizure frequency has reduced to less than 50% in majority of cases. And in that particular case, secondary to press, he has completely seizure free. There is no any drop attack, and he has started to attend the play school also. And about other cases, they are on all the medication along with the ketogenic diet and along with the CBD oil. And the seizure frequency has definitely reduced to less than 50%. As Raju sir has told that he has many cases of they have used more than 60 cases with CBD oil, and even in developmental epileptic encephalopathy. And so my experience, I have not used in any genetic, I mean, except two Dravet syndrome, no any other cases of LGS with a genetic etiology.
Okay,
But
madam, in basis of
NHI
LGS,
and
what are the
HIE, they
types
have
of,
good response.
okay, what are the type, means which type of seizures do responded well? Was it an
Drop,
atonic
drop, drop
seizures or
attack, drop attack,
drop attacks have
drop attack,
reduced?
drop
Yes,
attack, and tonic seizure.
they have
Yes,
reduced.
yeah, yeah. Drop attack, there is significant reduction in the drop attack and significant reduction in the tonic seizure also.
At what dosage you have used maximally?
Most of my patient has responded well to 10 milligram per kg per day. I mean 5
Okay,
milligram per kg per dose in
okay,
two divided doses. That is 10 milligram per kg per day. As sir
okay,
told, we must start at 2.5 milligram per kg per dose in BD
okay,
dose. I mean 5 milligram per kg per day. And most of them has responded to 10 milligram per kg per day in 5
okay,
milligram per kg per dose.
okay,
I think one of my patient has gone up to 15 milligram, and
okay,
he still there is lots of drop attack and lots of seizure, and they
okay,
want to go up to 20 milligram per kg per day to see whether they should continue further or they should discontinue the cannabidiol.
okay. So, have anyone has a paradoxical increase in the seizures? Because I had one patient, I have one total I used in 14 patients. So, actually, five have responded well, three didn't respond, and another subset is too early to say because recently started. But one patient was a case of refractory West syndrome. It's extensively worked upon. The MRI is normal, your birth history is normal, it's not genetic workup is normal, but we
West
have a West
syndrome,
syndrome.
infantile
Yes, yes,
spasm syndrome.
yes, West syndrome. It has a refractory, and later we started. So, in that condition, it has worsened and increased the spasms. So that is the only one indications where I've seen the paradoxical increase. So, sir, any case, or what is your experience about Vaikuntha Raju, sir? Any
Uh,
worsening in
yeah,
specific
yeah.
syndrome?
Few children has worsened.
Yeah.
So subtypes of seizure, maybe tonic seizures has worsened. LGS phenotype. Two children has worsened, and they discontinued also medication.
So
Mm.
tonic seizures have worsened. What that is your
Yeah, yeah, yeah.
okay.
So we
Sir,
don't know that is short term. Yeah.
sir, all of the many, most of the tonic seizure has worsened, or a few of them
No,
has
no,
worsened.
no. Few of them. Only two children. Two children has discontinued because of worsening of seizures.
Okay. So, rest, I think the
Sir,
panel
what is
is
the
Lokesh there.
sir? One my question is that a common question by the parents: how long it should be used? What is the total duration of this cannabidiol? Because it is too expensive for them.
Correct,
They are
correct.
so excited to use in the first, second month, but after second month, they are keep on asking, so how long I should use this medication?
That is similar to any other anti-seizure medication. So you should be
2 years.
seizure free for 2 years, and you should taper. And most of the time, they should be having already another anti-seizure medication. Also, you should be decrease and taper. These children less likely to be seizure free. What you are starting most of these children, so that they should understand also. Yeah.
Usually, people have this thing that it's unlike
Mm.
ligabetrin, which has a common side effect that we accept. The CBD doesn't have such side effect that you should have cumulative side effect otherwise. So you have to use it for the, as I said, for the 2 years for usual anti-epileptic. So Lokesh is there. Other panelists are joined, or they will be joining, or should skip them?
No, sir. Actually, Dr. Lokesh, I think he's traveling, so he's a limited connectivity. Maybe.
Oh,
And
okay.
sir,
And
we have
what?
one question from audience.
Yeah.
You want me to read out for you, sir?
Yeah. So how?
Like,
Yes, there is a
how?
question: how to follow the CBD effect if the patient had no visible seizures, however, EG showing generalized discharges, probably genetic epilepsies. I think that question was addressed, but I think Vaikuntha Raju sir can.
Yeah, there are many issues in this. It is similar to any other anti-seizure medication. After starting, when seizure becomes seizure-free clinically, most of the times you need to, this epileptic syndrome, you need to advise the EG also whether clinically, not only clinically, electrographically they are seizure-free or not. Because these children sometimes, if they are seizure-free, but EG is showing discharges, but you should be sure that some subtle seizure they may be missing because of sedation, sometimes non-conscious status. You should ask in detail clinical features, and video EG is a better option. Whether the clinical seizure, some subtle seizure they are missing, and despite that, the EG's abnormalities are there, and if child is not significant improvement clinically, you need to treat it like epileptic encephalopathy syndrome. We may need to give other medication also. So you need to consider all factors.
Sir, do you feel that in a recent future there will be its use in the acute refractory or super refractory status or like that in those patients? I think Madam was sharing an experience with the acute symptomatic seizures, which was refractory secondary to press. And so, do you feel that have you used, or do you feel that in near future there will be
No,
a
that
role of
was
CBD?
not. That was not. I mean, that was not presented with starters. That was
Okay,
the complication. The child was absolutely fine till the age of 1.5 years. Then he developed
okay,
PRES. Then he developed LGS. And for
okay,
LGS, he was on 4 or 5 anti-seizure medication and along with steroid for 2 to 3 times. When he came to
but
me,
what
also
was the total history from the press to the onset of LGS?
praise to LGS around 1.5 year. 1.5 year.
Year,
Yes,
okay.
one or 1.5 year. You can
Okay, I
one
felt
or
that
one
it's
and a half
like
year.
acute
Yeah, one and
symptomatic.
one and a half year. Yes.
Okay,
Because
okay,
he was absolutely fine till the age of 1.5 year. He developed
okay,
breast at 1.5 year. Then he
okay.
developed LGS and he came to me at the age of 3 years. I think after 1 year he developed LGS. Yes.
Oh, okay. But sir, in acute neurology and the status and this thing, do you feel
Yeah,
that
regarding
He has not
regarding
developed
because of
status.
its novel effect?
Regarding acute neurology, as already there are few cases I shown in the literature. The two five children have responded and their seizure period almost 1 year. So I shown one case also responded our child. This child you thought of autoimmune etiology, but most of the workers is negative. It is fitting autoimmune, but you have tried immunotherapy, including IVIG, rituximab, steroid long term also. Not much difference. And to think of other causes, so your extension include the genetic workup as the no possible cause. That child has responded more than 90%. Recently started, but child responded almost. I think will be seizure free after increasing the dosage. So that child is the one child responded. So and literature also there are two children. There are few case report that there is a improvement with five children also.
Sir, your all the 60 cases, those who are receiving this cannabidiol, they are on which dose? Right now, they are on 10 or 15 or.
Yeah, usually they are in the lower dosage in that seizure pre become what I told they are genetic epilepsy. One is an SYN gap mutation that is a brain MRI structurally normal, and other is a Down syndrome where genetic extensively done where there is other than Down syndrome no other pathophysiology but tried as tried. These children both MRI structurally normal. These two children responded seizure pre become also. They are required only low dose in 10 mg only, not 20 mg per kg.
I do have one question that there are two significant properties of CBD, that one is neuroprotective and anti-inflammatory. So it may prove beneficial in future in inflammatory disorders, inflammatory disorders, and if we
Within status.
we may use early also for in our neuronal developmental stages as an anti-seizure medication, which are specifically like West syndrome and Lennox-Gastaut syndrome early, so that you can use this benefit of neuroprotection.
Correct.
So
Sir,
is
is
it
there any role? My question to sir: is there any role in autism and this ADHD or any neurodevelopmental disorders like autism particularly?
Such I have not seen any studies, but may come. But some children notice parents, even though seizures are not decreased, there is notice there is improvement in the behavior. They are happy with that, even though the seizures are not improved. They notice that improvement in the behavior. I don't know whether it is a placebo effect because they think CBD is a natural medicine compared to the regular one. So we don't know that. Only few patients.
I think we need
Have you
more
used
studies in the
for
data to support that.
spasticity and
Shika, can you make some comments? I think we will be on the ending part of this. Shika,
Hello, can you
Dr.
hear me?
Shika is yeah,
Yeah,
yeah.
yeah. I was
Yeah.
just
Hello,
first.
Dr. Varsha, Dr. Vinny. It was nice presentation. This is Madhvi here.
Okay, okay. Madhvi madam is there.
I just have one question here. Whenever if we plan to use it off-label, like in child with refractory epilepsy, significant hyperactivity, uh, is there any protocol or should we be getting any consent from the parents?
Vaikunta sir.
Yeah.
Yeah, definitely you are not using and not approved. You should explain to the parents and
Yeah.
you should explain only if they're willing and taking consent, you should better to use because it is not indicated definitely.
sir, when we can say that this is not responding, at what dose and after how many days we can say that cannabidiol is also not working because it is too expensive. So when we can think that it is not working and we can plan to stop.
But kinetically, it shows that usually 7 days it takes, but to reach maximum dose, if their affordability is not an issue, no further deterioration of seizure and no side effects, you can reach 20 mg. It may takes another 4 weeks. To response also, it takes 1.5 month to call as a non-effective, at least 2 months maybe up to.
Because the drug is expensive, madam want to say I think the one what will
Yeah,
the one bottle get finished
yeah,
off?
Yeah, because they will be keep on asking ki,
Yeah.
how much when should
The bottle
when
should
should
not be
we
there
think.
left like that.
Yes.
Because it's not in the it's only in the liquid form. We have to take care of this only. Otherwise, tablets we can refund otherwise.
No,
Syrups
actually,
once.
they can because the dose is very there is calculated syringe is there, so it is very easy to give them, and it is not difficult actually. One more question to sir. Sir, have you used this molecule for pain, spasticity, and other things?
No, not at use because there are many other medicines also there, and there are
Yes.
many surgical options also there because it is expensive to use. If there is a
Yes.
comorbidity, maybe you can use definitely. We can tell that if pain and especially a major problem, we can advise that is one of the factor of CBD. It may helpful also, but its help alone is not used.
Sir, I just
Yes.
have a last question, I think, because already it's late. What is your like you always use it as a third line, fourth line like that, or what you
No,
usually?
no. No, most of our pay court is most of the times currently with drug resistant. Most of them they're used. They should have been used already available drugs. Most of them should have been already used. You are not currently you are not using as a third or fourth drug unless some patient may ask because they think it is a plant-based medicine. Those children were not used less than 5 or 6 medicine, none of the patient. Most of them, they should have used already available drugs in India.
Sir, one last question to sir.
Mm.
Sir, can we use cannabidiol below 2 years?
DCJ approved after 1 year of age. And most of these approved is the three main indication: Dravet syndrome, LGS, tuberous sclerosis. The situation most probably will not come. So LGS usually will appear in the second or
Yes,
third
up to
year.
2 years.
Dravet syndrome usually refractory started in
Yeah.
the second year, and TSC most probably will use Vicabactrin as a first choice initially. So the clinically chances the situation comes practically less likely unless if some developmental epileptic encephalopathy. TCJ approved is more than 1 year actually.
There is a brief comment by Dr. I think Ankit Pandya. He has written that it's a significant topic in recent advances in psychiatry. However, its use in psychiatry is to be established. So, apart from this epileptic indications, other indications of psychiatrists are not there. That's what I mean to say. Any other question from the panelist?
I have one question.
Yes, sir.
I have one question that in cases of mental retardation and progressive encephalopathy in the formative year of the brain, that is from birth up to the third year, if you don't stop the seizure, it is a major concern for the parents. You are keeping the patient on two, three, four, five, six drugs, and there is no control of seizure. If you can control seizure by adding cannabidiol, this is a great relief to the parents. Just the price is matters a lot. So we have to continue, and this seizure control results in improvement in cognitive aspect of so many patients, motor aspect of so many patients. I am a pediatrician as well as neuropsychiatrist, and I have seen in my patient that those who are having brain damage due to seizure, they improve excellently after seizure control. So this cannabidiol is a good introduction in the market. We can use it whenever required.
So, what dose you
That's all.
use in adults, sir? Adults, what dose you use in adults? It's a maximum dose.
I have not used in adults. I have used only in children. Yes,
Okay, okay,
5 milligram per kg body weight per day to start with. Yes.
okay, okay. Anyone like to make a comment so that we'll conclude? I think one brief comment from each panelist. Varsha, madam.
Yes, at the end of the session, we may take the message that it is new drug for us, a bit costly drug, but still it's promising because we don't have anything in hand, and there are a lot of burden of refractory cases with us. So maybe we will wait for it to become economical for the patients, and it yeah, with a less side effect profile, it may be a promising drug in future. And maybe, as I said, it may be used in some immunological cases, and it may prove neuroprotective also. Thank you.
Yeah, yeah. Thank you, madam. Shika.
I would also like to stick to the indications for the three indications I would say, and that is the thing.
Yeah. And we will definitely wait for other indications and studies to prove its role in other indications so that we can free to use in other drug refractory cases as well.
Yes.
Dr. Sharma sir, you want to add anything?
Yes. Since in India, since last thousands and thousands of years, they are using extract of cannabis in different forms by
Okay.
gurus like Charak and others to control the mental symptoms and seizure as well. So many components, as our learned speaker has told that this cannabis plant has 500 components. Out of this, tetrahydro except 5 tetrahydrocannabinol, other are very useful, and they are used in cases of inflammation, in cases of neuroprotection, in cases of seizure control, in cases of dermatological lesion, and in cases of psychosis as well. So the indication, more indications will come for this product. This is pure cannabis oil, and I hope that future you will reduce the price so that every patient can continue with the treatment for long. That's all.
Yeah. So I think Vaikuntha Raju sir has, I think, the maximum number of patients till now. I have seen anyone having 60 patients is too much that he's having. Sir, just a last take home for everyone, and then we'll conclude to the chairperson. Yeah.
Yeah, this definitely there is a definite role of this medicine in drug refractory epilepsy. As sir has told, baby's IQ is decreasing day by day with number of seizures. There is no other option. You can improve his IQ, at least stabilize it to improve, other than control of seizures. So nothing is going to helpful in the world. As those children, at least if their affordability is not an issue, you should always explain to them and you should consider this medicine
Yeah.
to decrease the seizure so that indirectly it will improve the quality of life also. That is a major.
Yeah, thank you, sir. Thank you for that enlightening talk. It was really you have touched the almost every single aspect of its use and made us more knowledgeable about it. So over to chairperson, madam Sasmita Devi, madam. You can conclude the session. I think that's the end from my side.
Thank you, sir. Thank you, Vaikuntha Raju
That's
sir, for
great. Yeah.
such an enlightened talk on cannabidiol, the newer vistas and the drug refractory epilepsy. And thank you, panelists, all the panelists, for their input on this. And thank you, Beneath and Intas, for such a wonderful CME today. Hope to see more in the future. Thank you.
Yeah.
Thank you very
I
much.
think this is important from the inter side because they are giving this platform for the improving the update about this newer drugs. Thank you once again, and thank you all panelists for giving the valuable inputs. Thank you so much.
Thank you, Vineet. Thank you, Dr. Vaikuntha,
Thank
Dr.
you. Thank you.
And thank you, INTAS team. Thank you. Thank you,
Thank you.
Pam.
Yes. Thank you very
Thank
much.
Thank you.
Thank
Thank
you
you.
very
Good.
much, sir. Thank you to all panelists. Thank you for all. We have more than 120 online viewers. So thank you for your
That's
help that has enlightened everybody and made it a very successful sharing experience. Thank you to
thank,
all. Thank you, sir.
thank you so much. Thank you so
Thank you,
much.
madam.